We're gonna take maybe 2 more minutes, and then we'll get started. Amy, I love your cat. So cute.
Thank you.
Oh, hello.
Oh, yes. Yes. I work from home and I have to contend with her, you know, hitting my keys, getting far all over my.
Sounds like a great assistant.
Yeah. So funny.
Great. I'm just gonna wait a couple more minutes. People are still coming on. I'm Mary Saccone, and I will be doing the presentation today. So we're still having a few people join us, so I'm gonna wait a couple more minutes and then we can get started.
All right. Just letting a few more people in. Why don't we get started? I'm just gonna go back to the chat maybe 1 or 2 times just to make sure we let everyone in, but I will share my screen shortly so we can get started, but I just want to make sure that everyone gets in here because we still have people joining. And I guess as people are joining now is a good time to talk about you know, just an introduction to the presentation. So this will be a presentation about suicide. I know this might bring up some questions that people might have, and I encourage you, if you come up with questions during the presentation, to put your question in the chat, or if you have a question about that specific slide and you really want to ask it right away, unmute yourself and just ask, because if I'm sharing the screen, I might not be able to see the chat, but if you
excuse me,
call it out, and then I will be stopping once we're done to go.
Excuse me, are you on the right presentation? Because I'm the host and it's my presentation on the update to the New Jersey Family Care Waiver.
Pretty funny.
All right. Well, I hope everybody is muted so that we don't have any overlapping discussions. Welcome. My name is Mary Saccone. I am the Director of Policy with Disability Rights New Jersey, and I'd like to thank everybody for joining me this evening for our 2024 update to the New Jersey Family Care 1115 demonstration waiver. Before we start, I'm just going to kind of describe myself for those who may have a visual impairment, can't see me. I am a 55-year-old woman with dark brown hair. I'm wearing reading glasses. I'm wearing a white shirt with a black blazer. And so that is who I am. And as I say, I've been with Disability Rights New Jersey for about 26 years doing a lot of this work. So I am glad you were all able to join us. So let me get started. Our agenda today, we will be starting with a short, oops. something happened with my PowerPoint. All right, I'm going to screen share this again. We'll try this again. Thought I had this all set. Okay. All right. Okay, before we start, what happened here? Okay. Our agenda is about disability rights. We're going to talk about Disability Rights New Jersey. We're going to give a background of the 1115 waiver. Then we will discuss the waiver renewal, and which included changes to existing programs as well as new programs. And then at the end, we will discuss issues that were not addressed in the waiver. Disability Rights New Jersey is the designated protection and advocacy agency for New Jersey. Each state is required to have a designated agency to receive federal funds to investigate and monitor facilities where individuals with developmental disabilities are located to ensure that they are not subject to abuse and neglect. We also advocate for and advance the human and civil and legal rights of residents with New Jersey's with disabilities. This program is being funded through support from the New Jersey Council on Developmental Disabilities, and we would like to thank them for their funding for this particular program. All right, so we're going to get into the background of the waiver. Historically, Medicaid had an institutional bias. For a long time, people could get funding to go into an institution, such as a nursing home, if they needed a level of care that they could not get at home. They could be funded for institutional services, such as a nursing home. But they did not have there would be no funding. They couldn't get funding for services to keep them in the home. This was always a long-term problem. So people would be stuck being placed in facilities such as nursing homes, even though they could be continue to live at home, which is what they would want, what their families would want, but they couldn't get any money otherwise through Medicaid, because Medicaid would only fund through
One Jewish and be about up there. You can tell that Danny shades his son. I think his name is Danny, no? I meant up into talk.
they could only get funding through
Actually,
they could only get funding through Medicaid for nursing home care. During the 1980s and 90s, Medicaid was amended to allow states to set up new programs such as waivers under Section 1915 that would provide funding for home and community-based services so that people could continue to remain in their home. The programs had to be approved by CMS, which was the Center for Medicaid and Medicare Services, as it would waive some traditional Medicaid requirements. Also, the programs had to be budget neutral, so it couldn't cost any more than it would to put somebody in a nursing home to keep them in their home. They would have to set up a program so that it would all be budget neutral, so it wouldn't cost any more money. New Jersey had a number of 1915 waivers to provide CMS services. Some of these waivers, in 2012, we transitioned 6 1915 waivers into the New Jersey FamilyCare Comprehensive Demonstration under Section 1115. Under 1950, these are different sections under the Medicaid Act. The Medicaid Act is a very large act with many, many sections. And the 1915 waivers were like very specific to certain programs. So we had one that was like for AIDS, people who had AIDS. We had one for TBI. We had one for, there were a number of them. I can't remember all of them. The thing was they would have each one may have had caps on them, like how many people could be in that waiver. So some waivers, there were more people that wanted services under that waiver than there were slots available. Other waivers, they didn't have enough people. And so it became an administrative problem, as well as it just didn't serve everybody by having these separate waivers. So New Jersey decided in 2012 to change how it was doing things. So they, as I say, they merged 6 1915 waivers into this demonstration. As when they were discussing it, the reason they did it was they wanted to streamline benefits and eligibility for 4 HCBS waivers under one managed long-term services and supports waiver. So they took 4 of them and pushed them together so that there wouldn't be these slots and some overfilled, some not filled enough, and it was just one managed long-term care services and supports. It would allow them to extend additional HCBS services to Medicaid and CHIP beneficiaries with serious emotional disturbance, autism spectrum disorder, and individuals with intellectual and developmental disabilities. It allowed them to establish a federally funded supports program for individuals with intellectual and developmental disabilities. It allowed them to increase community-based services for children who were dually diagnosed with IDD and mental illness by providing case management and behavioral and individual supports. It allowed them to extend managed care to individuals in need of long-term services and supports and divert more individuals from institutional placement through increased access to HCBS. And one of the things was they were hoping to eliminate the 5-year look back at time of application for applicants of long-term services and supports who had income at or below 100% of federal poverty level and who would self-attest they have not transferred resources for less than fair market value. In 2014, the waiver was amended to include the adult expansion under the Affordable Care Act. So in 2014, that's when the Affordable Care Act went into existence, and there was a whole new category of eligible adults under that program. So this was allowed, this was amended to include that group of adults. 2016, it was amended again to expand eligibility and benefits under the supports program for individuals with IDD. So 2012, it was approved for 5 years. They had 2 major amendments in 2014 and 2016. And then in 2017, it was up for renewal, and it was renewed for another 5 years from August 1st, 2017 to June 30th, 2022. Some of the big changes in that was it converted the children with serious emotional disturbances and IDD with co-occurring mental health diagnosis pilot programs into the Children's Support Services Program. The other major change was it transitioned the community care waiver, which was a 1915 waiver that had not been transitioned in 2012. It moved it into the 1115 waiver. It transitioned it from a separate program into the 1115 waiver. So in 2022, it was supposed to be up for renewal. However, COVID happened in 2020. So there was a lot of things going on. There was a lot of things for DMH, Division of Mental Assistance and Health Services, they had to do with CMS. So CMS extended the expiration date. So it was actually renewed. It was not renewed until March 30th, 2023. The renewal is effective from April 1st, 2023 through June 30th, 2028. So this new waiver is now good through June 2028. Some of the big things that were done was it continued most of the services that were already in existence in the prior waiver, but they did have some changes. There were changes to the DD supports program and the community care program. There were changes to the children's supports program, and there were changes to behavioral health. In addition, there were some new programs and services. A major change was under health-related social needs services, which includes housing supports. There's a whole new housing supports program, as well as nutrition supports. There is an autism adjunct services pilot. Prior to this, there was an autism services program that was, I believe in 2020 was put as the state plan. So it was moved out of the waiver and into the state plan. This is an autism adjunct services pilot. So it's a different pilot. I'll explain about it a little bit later. It also allowed for 12-month continuous eligibility for adults whose eligibility is based upon their modified adjusted gross income. So these are individuals who are eligible for Medicaid under the Affordable Care Act expansion. And since they don't need that, since there's no asset limit discussion under that, this allows for basically continuous eligibility, recognizing that people's income might change from month to month, and they don't want to lose eligibility because one month it might be higher than over the limit and under the limit. So it's maintain eligibility for the 12 months. And then there's some new maternal and child health care programs. I'm not going to really discuss those because I'm focusing on disability related issues. But if you have questions about it, you know, feel free to reach out to me and I can talk to you about it at a different time. But I just wanted to let you know that there are some maternal child health programs that are new from this under this waiver. So let's start with the DDD program changes. Now, both DD supports and the community care program had similar changes. The first major change was eligibility for 18 to 21-year-olds. The the waiver expanded eligibility to 18 to 21-year-olds who had exhausted entitlement services from their school districts. Now, when this happened before this waiver, people who were, there were no support services, or there was no DD support services for anyone under 21. Everything would be under the Children's Support Services program. And as a result, so this is a new entitlement, or not an entitlement, I'm sorry. It's a new program. The actual waiver has no limitation on this provision beyond requiring an exhaustion of entitlement services under IDEA, and you cannot be duly enrolled with the Children's Support Services. When this came down, our office was very concerned about this because school districts have a habit. There have been a lot of school districts that try to graduate children, this 18 to 21-year-old group, before they are 21, because as soon as they graduate, the school district is no longer responsible for the child. So there is always a lot of pressure, especially come June, to try to encourage children or youth that are these 18 to 21-year-olds to graduate. And by setting this program up, we were concerned that this was going to encourage school districts to graduate students earlier than they had been graduating, or that they would not provide the transition services to 21 as in the past. But what we were told was this was a way to make sure that, because school districts are going to do this regardless, that this way children there would not be children who fall through the cracks or youth who fall through their cracks. So if they do graduate, then they will have this opportunity to get the services. So as I said, in the waiver, there is no limitation on who is, all they have to do is exhaust their entitlement, meaning if they graduate, they have no entitlement services for IDEA, and they can't be on the children's support. Come April, this past April, DDD issued guidance, but they limited this provision to only those who are seeking services to support immediate enrollment in a post-secondary or trade school, or seeking competitive integrated employment. So if the school district graduates the person, unless they are in those two categories, they cannot get the DD supports or the DD community care program services, unless they are currently actively seeking immediate enrollment in post-secondary or a trade school, or they're seeking competitive integrated employment. So the catch-all that was supposed to be the purpose of this is not really there. It's limited quite a bit. We are concerned that, and what happens about some people who decide they want to graduate because they want a job and they're going to go get a job, then they get out in the real world and they either don't get a job or they are not successful and they fail. And they've already graduated, so are they still going to be able to keep the supports program at that point? It's not really clear. So there's a lot of concerns about this. There was no, and I say the guidance does not really talk about that. It just basically says this is only available to those who've graduated, and they must be seeking immediate enrollment in a trade school or post-secondary school, college, community college, vocational program, or they're seeking competitive integrated employment. So it is not, but we're concerned that school districts are going to continue to try to graduate people, especially now that they know the waiver program allows for supports for people who are with IDD. So we're not sure how this is going to play out, but we are concerned about this limitation. A couple other changes that were being done. As I said, the biggest change was the 18 to 21-year-olds, but there's been a couple other ones. There's some caregiving changes. Under the waiver, individuals who serve as a representative of a person with IDD may also serve as a provider or a worker for that person. It was originally a temporary measure under COVID, and it's now been made permanent under the waiver. The other thing, and this kind of came out of COVID, but we're not sure if it's being implemented yet. Direct support professionals will be able to provide care during a hospital stay. When people went into a hospital during COVID, they weren't allowed to bring anybody else. It was very problematic. So one of the things that was suggested was that people allow their DSPs to be able to go and provide services in the hospital setting to help an individual while they're in the hospital. The waiver specifically allowed for this. They requested a modification under the services, under the community-based support services in the support program, and a modification under the individual support services in the community care program to specifically allow for DSPs to be able to provide care if the person goes into a hospital. However, the most recent policy manual from April from DDD does not mention this modification under either program in either the community-based support services or the community-based or the individual support services in the community care program. It's not that it's just not mentioned. It's not so it could be being allowed. We're not really sure. But the waiver specifically in the during the proposal specifically allowed for this. And so if your child or family member goes into a hospital and you want to have a DSP provided, technically under the supports program or the community care program, that should be allowed. But as I say, it's not very clear from DDD's manual whether they are accepting that change. So we're still trying to figure that one out. All right, we'll move on to the Children's Support Services Program. It allows for, under the Support Services Program for children with IDD, it allows for youth with IDD who meet the Children's System of Care's functional eligibility, which is individuals who are diagnosed with a severe chronic disability manifested before age 22, is likely to continue indefinitely and results in a substantial functional limitation in 3 or more major life activities, or for children birth through 9 who have substantial developmental delay or a specific congenital or acquired condition that has a high probability of meeting the substantial functional limitation of 3 major life activities later in life. So those are the people who meet the Children's System of Care functional eligibility. And they provide services and supports are based on the individual's plan of care in cooperation with the care management organization. So that's what the Children's Support Services Program sets forth. In this renewal, they expanded eligibility for children with IDD. Under the 2017 renewal, authorization for eligibility was granted for HCBS services and Medicaid state plan services if household income was less than 300% of the federal poverty level and the child was at risk of hospitalization. So if household income was at 300% or of the poverty level or less. Unfortunately, that was never actually implemented. So in the 2023 renewal, Medicaid said, you know what, we need to implement this. But not only do we need to implement this, we are going to expand on it. So they changed it so that they will disregard parental income for children needing the institutional level of care. So as long as the child's income is 300% of poverty, or 300% of the federal poverty level or less, then they would be eligible for services, HCBS services, as well as Medicaid state plan services under this waiver. And since for most people, the income is parental income, most children do not have their own designated income. This allows for eligibility for almost every child in New Jersey who would meet these eligibility criteria. However, even though they said they were going to implement this, they were going to implement the other one, they still have not implemented it yet. But they keep telling us it will be implemented shortly. In addition, the Children's System of Care has not provided any guidance about the application or eligibility process. So we're still waiting to hear when this will go into income and asset, or just income. It's income. Someone just asked a question. Income. It would be income. The household or the child's income. Again, you know, as I say, they're not taking into consideration assets of the family or the child, to my understanding. You know, my understanding is it's income. They will disregard parental income. Now, if the child has a lot of assets, I'm not sure. I don't know. I'm not going to say for sure. But generally, in most cases, the assets, again, usually go to the parent, not the child. So yeah, parental assets, no, nothing parental. It's the household of one, and everything is with respect to the child. The child is the household of one with respect to this 2023 renewal. However, it's still not implemented as far as we know, even though we keep getting told that it's going to be implemented soon. In addition, we have some concerns because the Children's System of Care is going to have to increase their number of available providers under this system, because there is a current wait list for many of the HCBS supports and services due to limited number of providers. So even for the children that are under the system right now, there's been a waiting list. So it's going to be great when they eventually get all this implemented, so that children can not only, you know, they would have access to the HCBS services as well as all Medicaid state plan services. But would they, but it's still not implemented. Question, would they need to be open with care management organization to qualify? Yes, it has to be through the care management organization. There's really no yeah, I know that's the problem. So, but as I say, through the waiver services, they should be able to get, you know, services through the waiver and through the Medicaid state plan. But as I say, there are problems with this Children's System of Care. They need to increase the providers and provide, because as I say, even if you are eligible for the services, if they have no providers to provide those services, you can't get them. So it's great that they're expanding eligibility, but we're still waiting on this. Now, for children with severe emotional disturbance, SED, it again will provide behavioral health and HCBS services to beneficiaries under the age of 21 with an SED and who are at risk of institutionalization or out-of-home treatment. As with the IDD program, they are expanding eligibility to children in the community who are at risk of institutionalization by disregarding parental income. Any child meeting the clinical eligibility threshold will be eligible for all state plan services through Children's System of Care if the child's income is less than 300%. But again, this expansion has not been implemented, and we're still waiting to hear from DMAHS or Children's System of Care as to when it will actually be implemented. All right, I'm going to move on to the behavioral health carbon. Under the prior waivers, many behavioral health services were carved out from the managed care delivery system and delivered on a fee-for-service basis. Some behavioral health services are excluded from managed care for all beneficiaries. A second set of behavioral health services are provided by managed care only for certain populations, those who are on MLTSS, managed long-term services and supports, DDD services, and dually eligible beneficiaries enrolled in a fully integrated dual eligible special needs plan. For all other beneficiaries, those services were fee for service. So in the new waiver, all or most services that are currently carved in for the DDD, managed long-term services and supports, and the fully integrated dual eligible special needs plans would be carved in for all or most Medicaid beneficiaries enrolled in managed care. So basically, the small group that had already managed care carve-ins would be expanded to everybody who's under managed care to get the specific services that were already carved in for the DD people and the MLTSS people. And then what they're looking to do over the renewal period is they are doing a systematic review of all services that are fee for service and excluded from managed care for all beneficiaries to determine if such services are appropriate to carve in to managed care. They are supposed to be working with stakeholders about this. There was a lot of people who are not happy about this whole system. It has not been fully implemented. As I say, they're carving in the ones that were already carved in for a certain group. They're just expanding who those are carved in for. The ones that were completely carved out, they are going to be working towards carving them in over the course of the waiver and with stakeholder input. All right, so now I'm going to move on to new programs. And this program is one of the ones I'm really excited about that they're doing in this waiver. It's for what they call health-related social needs services. There is all kinds of evidence that people who have housing issues, if you're homeless or you're at risk of losing housing, have worse health-related outcomes. So there are by working on housing and social needs that directly affect a individual's health can make a big difference in a person's quality of life and their general health. And housing and nutrition are two areas that specifically are social needs, but they have a direct impact on a person's health. So they have been approving pilots in other states to address these health-related social certain needs services. So in this waiver, New Jersey decided to propose new programs to specifically address some health-related social needs. First one I'm going to talk about is their new housing supports. Now, Medicaid rules specifically prohibit direct funding for housing, such as rent or money to build housing. So the new programs focus on housing supports to help an individual transition to housing or remain in their own housing. So right now it's currently being developed, this program. It's a major undertaking. They have gotten a lot of it developed, but it's not implemented yet. They are working on it. And I've been on a lot of stakeholder meetings, so I know that they have come a long way in the development of this. They are really dedicated to doing this. So some of the anticipated services and supports that they are looking at doing are pre-tenancy services, such as case management supports to help the individual find housing. For example, assisting with the housing search in the application process. Tenancy sustaining services. This is case management supports to help individuals maintain housing. Things that this might include is assist with lease renewals and housing certification, or assist in addressing circumstances and or behaviors that may jeopardize housing. They're also looking at residential modification and remediation. So those would include such things as modifications or repairs to home to ensure health and safety. For example, provide remediation services such as air filtration devices, modify the home environment by including ramps, handrails, grab bars, things like that. And also they're looking at providing move-in supports, such as payments to support the setup of a new housing or the move. As I said before, Medicaid prohibits the funding to be used for rent or housing production. So in this case, that is not what this money will be used for. It does not include payment for rent or housing production. So who is eligible for this? The eligibility will be those who are enrolled in a managed care organization and meet at least one social and clinical risk criteria. Social risk criteria can include at risk of homelessness or currently experiencing homelessness, at risk of institutionalization and requiring a new housing arrangement, transitioning from an institution to the community, or someone who's recently released from a correctional facility. The clinical risk criteria is things such as chronic health condition, a mental health condition, substance misuse, pregnancy, complex mental health condition from an intellectual or developmental disability, victims of intimate partner violence, domestic violence, and/or human trafficking, people who need assistance with activities of daily living or instrumental activities of daily living, or repeated emergency department use or hospital admissions. As I said before, this is still in the developmental stages and specifics may change once it goes into effect. So the things I'm discussing here are still in the discussion stage. They are not part of the program yet, but these are the things that they're looking at doing. All housing supports will be coordinated through the managed care organization, which is why only enrollees of MCOs will be able to obtain these services. Infrastructure is currently being built and coordinated between the managed care organizations and the housing providers, or people who can help with housing assistance. And but at this point, it is not clear when it will be up and running fully. So that's where we are. In addition, they have a new nutrition supports program, which will allow for nutrition counseling and education for managed long-term services and supports members. It will also include one-time transition costs for including pantry stocking for MLTSS eligible beneficiaries who are transitioning from an institution to provide access to nutrition during the initial phase of the transition to the community. Once again, they can't really pay for food under Medicaid, but they are getting permission to pay to allow someone to stock up when they first move in so that they get all the basic staples in there so that they can start off with good nutrition. Okay, so those are the two major new programs under. Then there's the new autism adjunct service pilot. This is for individuals with an autism spectrum diagnosis up to their 21st birthday, and they're eligible for New Jersey Medicaid or Children's Health Insurance Program. And it's going to provide rehabilitative and therapeutic services that are linked to goals in the beneficiary's treatment plan, but outside the scope of the state plan authority. So there's a whole bunch of services under state plan for autism. These are additional services under this program, under this pilot. And these include recreational therapy, music therapy, or aquatics therapy. Now, again, it's a pilot program, and I'm not sure if it's fully operational implemented yet, but it should be shortly. As I talked about before, there's now going to be continuous eligibility for adults under the modified adjusted gross income MAGI, or we call them the Affordable Care Act Medicaid expansion. As I say, because that only the eligibility for services for Medicaid under MAGI, it's basically for anybody, any adult between the ages of 18 and 65 who have a yearly income that is 138% of the federal poverty level. Strictly based on income, there is no asset determination under MAGI for eligibility. So because it's income, some people's income really fluctuates from month to month to month. So in order to maintain continuity of access to Medicaid and health services and to minimize coverage gaps, what they've done is basically you'll get your yearly renewal, and then if you meet the requirements at that yearly renewal, then you will have it for the next year. Then after a year, then they will determine whether you meet eligibility requirements. But as I say, you will have continuous coverage during that year if you meet the MAGI requirements when you're up for renewal. Okay, so there's a lot of great stuff in this. There were some issues that were not addressed in this waiver renewal. First one is qualified income trusts. Now, qualified income trusts, QIT is a legal arrangement that allows people who are in need of an institutional level of care to qualify for Medicaid, even if their income is above the Medicaid cap. Basically, the idea is that for some people who don't qualify for Medicaid, they make too much money to qualify for Medicaid, but they don't make enough money to pay for home and community-based services or even to pay for a nursing home. So it's a way to spend down their income so that they can they spend down their income and set it up in a trust so that they can qualify for Medicaid to receive home and community-based services. Many people do not like this system because the process is burdensome and complex. And it's only available to manage long-term services and supports beneficiaries. Even though it's been approved in the past under the 2017 waiver for the DD supports and the community care program, it's never been implemented. So you can only get it if you were getting MLTSS. So the QIT Medicaid has said they were going to look at it and they will continue to look at it. We're going to continue to advocate for one that they expanded to make sure it's a use for people who need DD supports and community care program, but also that they come up with a system that's a little easier for people to use, because it's, as they say, you have to have a trust. There's certain rules about the trust. It's a very complex process and you almost need an attorney to set it up. Another issue that wasn't addressed was spousal impoverishment under the DD programs. As with the quality income trusts, rules to prevent spousal impoverishment have only been implemented as to manage long-term services and supports, and not the DD supports of the community care program. Basically, they don't count your spousal income, or they don't say the spouse has to become impoverished if a person gets Medicaid. But these have not been implemented with respect to the DD programs. Another issue that wasn't addressed is private duty nursing for the community care program. Currently, under the waiver, an individual can only be on one program. You are either under MLTSS, you are either under supports, or you're under community care program. You can't be on two programs. However, for people with developmental disabilities, they do recognize that they should have some type of opportunity to get private duty nursing. So what they've done is, if you are on the supports program, they have this supports plus private duty nursing program, which is basically you get the supports program plus you get the private duty nursing you are on MLTSS solely for private duty nursing. However, they do not have that same option for the community care program. So you cannot be on community care program and get private duty nursing. It does not make any sense because people who are on the community care program tend to have greater needs than the supports program. But the way they've set it up now is you can get private duty nursing solely under the supports program. That's something that we are working to look to change come the next, when they come up for renewal, or if they decide to amend it along the way. Because it just doesn't make any sense that people on the supports program can get private duty nursing, but people on the community care program cannot. All right, I know there's some people in here. I've seen some questions and I was holding this off to discuss when I got to this part. Issues that were not addressed. Approvals granted but not implemented. As I said before, in the 2017 program, or the waiver, the Children's Support Services was expanded to allow for families who are under the 300% household income of the federal poverty level could get state plan services as well as HCBS services. They never implemented that. And they admit they never implemented that. There are now programs in this waiver that have still not been implemented. after this was approved in March 30th, 2023. It is now September, almost the end. It's about a year and a half now since it's been approved, and they have not been implemented. Some we know are in the process of being implemented, like as I say, with the housing supports, but some of them, they just don't do it. Unfortunately, there is no enforcement mechanism to force DMHS to in fact implement specific sections of the 1115 waiver. However, there are opportunities to comment on the implementation. Recently, they just had in August of 2024 was the most recent one. I know our office made comments specifically related to the limitations of DDD with respect to the 18 to 21-year-old, the lack of implementation of the Children's Support Services program. So and the failure to do the community care program with private duty nursing. Those were some of the things we talked about in the program or in our comments. I don't know if they will continue to have opportunities to comment, but if they do, this is a way to continue to put pressure on DMHS to make sure that they actually implement what they say they're going to implement. And it's really important that as people who are using this waiver, that you raise your voices to say, hey, this is not being done, or this is affecting my ability. So those are some of the, so just so you know that they do have opportunities for comment, but they always aren't, you have to wait for them or look for them. So I see a question. Lena?
Yeah, my question is, how do we learn about these opportunities? How do we hear about them?
Well, I always go on to I'm always checking the 1115 waivers website page on the DMHS website. They have a 1115 waiver page, and you can go on and it lists it shows you the waiver. It goes through all of the information that they have about it. One of the things that we still haven't gotten is under the waiver, the home and community-based services are supposed to be listed under what they call attachment C. There is still no attachment C. There's nothing under attachment C. So we're still waiting to hear what they count as home and community-based services under attachment C. It's been a year and a half. So this is not the fastest of processes, but the way you do it is you go on there, and if you see an opportunity to comment, like as I say, we found out about this and we're like, oh, I'm commenting about all of these issues, and that's what we did. Because as I say, a lot of people don't know that. They don't know that there's an opportunity to comment. But again, you can always reach out to, write your letters to the director of the Division of Medical Assistance and Health Services. The current assistant commissioner is now Greg Woods. So you reach out to him and you write your letters to them and basically say that this is a problem. This is not being implemented. What can we do? But as I say, we're on regular meetings, and the children's system of care issue is a real problem. We have been arguing with them for 18 months about its implementation, and they keep telling us it's coming, we're getting there. Because one of the big issues was the past 18 months, they've been working on the Medicaid unwinding from the public health emergency. So a lot of people are getting kicked off of Medicaid, and we're like, well, they should be eligible under this program. Well, program isn't implemented yet. So it was always, so we have been on their case about this for a while. But the more people who continue to complain about this, the more likely that they're going to move on it.
Are there opportunities for templates on like what to say in some of these letters, and then adding like our own personal note to it? Like, I get overwhelmed on where to start, and even who are those right people to contact. So if there is some sort of like directory, like I send one about student loans all the time, but it's like a templated letter that gets sent out. So like, even if it's just kind of like, here's what we suggest you say, or I don't know if that's appropriate, but like I stare at a blank page and I'm like, I don't know.
Yeah, we haven't done a template. We have never done a template, so I can't really say that. So, that's one thing that I'm not really sure, but, I do know that there are, there's I know that there are certain groups out there that might be able to provide assistance on that. I'm trying to think. I was just on a webinar that was
Because I've
talking
I've
about.
contacted and asked for assistance from SPAN, from Children's Health Services, for Special Child Health Services, from all these different agencies, and I've never experienced more paper pushing and lack of supports than for my son. And so, like, again, the support in just, you would have more voices to be heard if there are letters accessible, if there are templates. So then it's an easy sign, it's a copy paste, it's adding your little bit of like why it impacts your family directly. You will have a lot more numbers behind you in that, if it's
Yes.
possible. Because again, I don't know the first thing to be saying, because
Right,
I
I
want to say
understand that.
this sucks and like we're shutting down, like, and we're struggling here. And like, it's not to bring the group down. I'm tired of the frustration.
I
So
understand that. I totally understand that. But I mean, we just don't normally write template letters, partly because we have so much that we're doing and we're working on getting our one letter out that we can't really get a template done ahead of time to help people. We do try to let people know if you get on our email list, we could let people know, hey, there's an opportunity to comment. Since they just had one, I don't think they're going to have another opportunity to comment until usually it's about every 6 months. And my hope is that they keep doing them every 6 months, because I know there's been 2 opportunities since this went into effect. So, and I know we just had the last one in August. So there won't be another one, I'm sure. But having said that, you can know it, at least knowing the rules and what's in the waiver, you can go, like, you're involved with the Children's System of Care, I'm assuming. You can go to them and say, hey, this waiver says I should be able to get these services. And when they do, and they come up with their 20s, no, it says I should be able to get these services. You tell me why not? Why can't I get these services? So knowing what your rights are under the waiver is at least helpful on a regular basis when you're dealing with a specific agency.
Sorry, so can I ask you a quick question? My son, because you talked about people getting kicked off of Medicaid. My
Yes.
son is 13. He has Down syndrome, autism, and cerebral palsy. And we had Medicaid, and he has other stuff too, and a bunch of health conditions and blah, blah. But we were on Medicaid, and we just got kicked off. So how can I use this to get back on quickly?
Well, I can't really give you legal advice right now. What I would suggest you do is, I know we have been doing Medicaid termination cases. Legal Services also does Medicaid termination cases. You can reach out to our office or to Legal Services.
I just got an advocate through the state, yes.
Okay. So I would talk to them about how you go about getting reinstated. If the termination was improper, you need to file an appeal right away so you don't lose your services.
I did lose my services, even though the letter said I had 60 days to respond.
You have to
terminate, and I did respond. They still terminated my services 2 weeks later.
Yeah, you only have 20 days to say you want to continue services. You can appeal, but you got 20 days to request continuation of service. It's a very difficult process. But what I would suggest you do is work with your advocate on that issue and to see if you can get your services reinstated while the appeal is pending. I don't know if you can or not, but I know that because there's strict deadlines in terms of, but if you said you wanted your services to continue, then they should have continued them. But as I say, I can't talk about specifically that issue, but I would suggest you work with your advocate on that.
But now this program is going to take place of his other Medicaid then, right? That we got kicked off.
It depends on how he's eligible for Medicaid. There are multiple ways you're eligible for Medicaid. This is one, this is one doorway to Medicaid eligibility. And as I say, the children's support, you have to get it through Children's System of Care, and it's still not been fully implemented yet. So it's not there, but there's several doorways to get into Medicaid. And it's just a question, what was your child's doorway, and why did they terminate, and did they consider all other doorways to get into Medicaid? All right.
Okay, thank you.
Hi, Mary.
You're welcome. Does anybody else have any questions about the material we just discussed, about the waiver?
Hello.
Yes.
Oh,
Jennifer?
hi. I'm sorry. I do have one quick question. You mentioned that the DMAHS is the one we should put pressure on. Is there anyone above them that we can put pressure on that would then buckle down on that particular department?
Well, they answer to the governor. So
So
you know,
writing straight.
you've got so basically DMHHS is a division of the Department of Human Services. So the Division of Medical Assistance and Health Services is under the Department of Human Services, and they are under the governor's office. So it's all part of the governor's administration.
Okay, so he would be the top chain of command to reach out to, so to speak.
That would be the top, that would be the top person.
The highest. Okay.
The highest level in New Jersey I mean, you can also go to the Center of Medicaid and Medicare Services, CMS, and, complain to them that New Jersey is not operating their Medicaid program properly. That is also an option.
Okay, thank you, because that's kind of like where I think a lot of the parents probably should head to, because if you continue to repeat yourself and nothing's being done, like, I guess it's time to go over people's heads.
So this presentation will be available on our website. There's being a recording of it, so it will be posted on our website, and the slides will be up on the website as well. So if you missed something or you wanted some information, you would be able to obtain those through our website. Any other questions? We're almost out of time. All right. Well, thank you all for coming. I really appreciate you all taking the time out of your evenings. I hope I was able to provide you with some valuable information. As I say, some of the stuff's really good. Some of the stuff is not so good, but it's important to know all of the facts so that you can advocate best for your family member or yourself. All right. And thank you.